Hello, this is UtahMarijuana.org, and I am Tim Pickett with a quick video on how to correctly enter a delivery method and dosing recommendation for the Utah EVS system. Go ahead and log in as a QMP and select your name. On the right-hand side, you'll need to enter the certification for the new patient. Enter the patient's data, scroll down and hit save. At that point, find the recommendation tab or the blue recommendation link and enter a new recommendation. Each of the dosage forms that are allowed under Utah law require a recommendation in order for the patient to be able to purchase medical cannabis at one of the pharmacies. In this case, we've used the state maximums of 20 grams of THC concentrate as needed for a 30-day number of dosage days. At each time, scroll to the bottom and click Save. The EVS system does not have a Select All option, and each dosage form again needs its own separate recommendation, similar to a prescription where you are specifying the type of medication, the route of delivery, the amount to be taken, and this allows for a detailed recommendation similar to a typical medication, even though cannabis tends to be dosed or delivered a little differently than a typical medication. You need to go through every one of these dosage forms. There is an alternate method. This puts a little more work on the pharmacist. In this case, we'll use unprocessed cannabis flower as the example, again using the state maximum 113 grams or 4 ounces of unprocessed flower as needed, and we'll paste in notes that are specific to our patient and allow the pharmacist to make a delivery or change the delivery recommendations and add those add more information to the patient's recommendations as the products change in the pharmacy. In this case, we have allowed the patient 20 grams of THC concentrate and the full 4 ounces of flower per the pharmacist recommendations. All forms and delivery methods per the patient preference are allowed. Then the pharmacist would need to go through and add the individual recommendations. This does work, however, it is more work for the pharmacist, but if you don't know the products that are at the dispensaries, it's a pretty decent method. Hope this is helpful. Thanks for watching. Find us on UtahMarijuana.org, chat with us, or give us a call with questions. We're happy to help.